Good afternoon, and thank you for joining us for the 2020-2022 State Health Improvement Plan Community Conditions Work Team Meetings. And just a shout out to all of our champion work team meetings attendees who have been with us over several calls. We thank you for your attendance and participation. My name is Erigina Clay. I am a health policy analyst at the Health Policy Institute of Ohio. So a few things to keep in mind before we get started today is everyone is in listen only mode currently. If you would like to leave a comment or a question, you can do so by entering it into the question box. We want this to be an interactive meeting, so please share your feedback with us. If you would like to raise your hand during the discussion, we will unmute you on our end, but if you've muted yourself, you have to unmute yourself in order for everyone else to hear your comments. Once again, make sure that you've entered your audio PIN. You'll need to log into the webinar first before calling in order to obtain your PIN. And as a reminder, the community conditions meeting slides and other materials, including the recording of today's webinar, are going to be available here on HPIO's Shaw Ship webpage. And here's the organizational chart of all of the stakeholders involved in the SHIP. And to locate yourself, the community conditions work team is located at the foundation of the structure. So now I'd like to take a moment to introduce all of my colleagues at HPIO. Joining us today in the room, we have Amy Bush-Stevens, Reem Ali, Zach Reet, and Alana Clark-Kirk. You should also see a list of today's webinar participants on your screen. So here's our agenda for today. In a moment, Amy will provide background information on the SHIP process and purpose and list of outcomes and indicators for community conditions. Then we will move into some discussion questions and some polls. And the goal is that we will set the overall targets, identify priority populations, and setting priority population targets. We'll conclude today's meeting with next steps for the project. So as a reminder, our objective, which I'm sure many of you all are very familiar with, is for HPIO and ODH to have the guidance needed to finalize overall targets, priority populations, and priority population targets for community conditions. As a reminder, no final decisions will be made on the call today, but your input will guide the final decisions that are made over the next few weeks, which are critical. And now I'm going to hand it over to Amy, who will review the SHIP process and purpose.
Good afternoon, everyone. This is Amy Stevens at HPIO, and we are very excited to be hosting the last in a series of 6 work team webinars on setting targets for the State Health Improvement Plan. And the community conditions topic is certainly one that has gotten a lot of interest, and so we're really excited to see some new participants in the SHIP process as part of this community conditions work team, including folks from education and housing and other sectors as well. I'm going to start with some basic info on the State Health Improvement Plan process. And this is the timeline for the work. So the endpoint that we're aiming for is to submit the State Health Improvement Plan to the Ohio Department of Health by the end of September. And so we are right in the middle of the process here in July with the target setting and priority population phase of the work. And then next week and into August, we will be moving into the strategy selection phase of the work. Throughout this process, we are doing this work in partnership with the Maternal and Child Health and Maternal infant and early childhood home visiting, or MICV, assessments that are also happening, that we work that we're doing in partnership with the Department of Health. The purpose of the SHIP is to get us all rowing in the same direction to improve population health in Ohio. That's why it's important for us to be concise and prioritized toward common goals. We know that prioritizing can be difficult work, but it's necessary if we're going to be strategic about working together to improve outcomes. The SHIP will be a tool to align state agencies. We have a steering committee for this work that is made up of directors or their designees for all of these agencies. So this is much bigger than just the Department of Health. The SHIP is also a tool for alignment and collaboration at the local level. So thinking about all of the different local community-based organizations and different sectors that impact our health outcomes. The SHIP is our opportunity to track progress over time. This chart takes a look at an early look at Ohio's progress on the objectives in the previous SHIP. And on this chart, green indicates things are improving, yellow means little or no detectable change, and red means things are getting worse. We know we have lots of work to do. The goal, of course, is to get Ohio into the green. So this is a vision for what we would like it to look like in the future when we report on SHIP outcomes. It's really all about progress and improvement. And the goal of the SHIP is to ensure that all Ohioans have the opportunity to achieve their full health potential. This means eliminating disparities and inequities and achieving equity. Now we'll take a look at the framework that we're using for the SHIP. This really guides all of our work and guides the structure of these work teams. This is a somewhat different framework from the one we used in the previous SHIP. We have flipped the SHIP, meaning that we put the focus on those community conditions and other health factors listed on the left in blue. We've simplified some of the language, so we have those questions across the top that are meant to be easy to understand for folks beyond public health. And then we've also elevated equity in the framework. And the red box highlights where community conditions fits into the overall picture. And today we're going to be, Zach is going to be sharing some data with us so we can dig specifically into these community conditions. But it's important to keep in mind how all of these different things are connected. So we want to be mindful of the ways that these community conditions affect the health outcomes that we have listed in green, but also the interactions with the other health factors in blue. These are the main components of the SHIP. We have our SMART objectives. Those are specific and measurable objectives. Priority populations. Those are groups with worse health outcomes. Evidence-based strategies and strategies to reduce disparities, inequities, racism, and discrimination. Our focus today is going to be on the SMART objectives and the priority populations. And then as we move into August, we'll be focused on the strategy part of the work. And as a reminder, here's our objective for the call today. Now I want to do a recap of the June 21st Community Conditions webinar that we had, where we talked more specifically about outcomes and indicators for community conditions. And to remind you of the process that we've used for prioritization, we started this work back in October of 2018 with the regional forums, where we gathered local stakeholder input. And then we also looked at secondary data in the state health assessment. And I should mention that the Department of Health will be releasing the state health assessment soon. So stay tuned and watch your email boxes to see that final report come out. Then we shared the findings with the steering committee and the advisory committee, and including the June 4th advisory committee, where we had a small group that was focused on community conditions. And I think some of the folks on the call today were part of that conversation. That was followed up with an online prioritization survey. And then we had the webinar on June 21st that helped us to narrow down and prioritize the outcomes to include for community conditions, which was definitely a challenging task because we had a lot of really compelling outcomes for consideration. So all of this feedback gathered throughout this process has helped us to come to our set of outcomes and indicators for community conditions. We're going to look at that in a minute, but first we want to get a sense of how many of you have been a part of this work team, particularly how many of you were able to participate in the June 21st Community Conditions webinar. That's the one where we prioritized the outcomes and indicators. Please take a moment to fill out the poll. Let us know if you participated in that webinar or were just able to view the recording or were not able to participate. And everything that we're talking about today builds upon this whole series of work. And so if you're new to the process, that's great. We welcome new folks to join the process as we move along, but we encourage you to check out the background materials on the HPIO Shaw SHIP page so that you have that underlying information. And I think Alana's ready to share the poll. Okay, so almost half of you participated in that previous webinar. About a quarter watched the recording, and then we have a number of new folks. So that's good to know. Okay, all right. So this is the list of the long list of desired outcomes that we considered and talked about on the previous call. We used these criteria to help us narrow down the list. And this is where we landed. These are the 4 desired outcomes for community conditions that will be included in the SHIP: housing, poverty, student success, and adverse childhood experiences. And then this is looking at greater detail, showing those specific indicators. And as you may recall from that webinar, we talked mostly about the outcomes, and then we've been consulting with folks at the Department of Education, Job and Family Services, Ohio Housing Finance Agency, and other subject matter experts to make sure that we select the right indicators. Now I'm going to provide some background on target setting and priority populations, and then Zach is going to bring us into a closer focus on those community conditions, outcomes, and indicators. Targets and priority populations are an important part of setting SMART objectives, and I'm sure many of you on the call are familiar with SMART objectives. Here's some examples of what SMART objectives look like from the previous SHIP. And today we're focusing on these red arrows here. So guidance for setting targets, and then also for identifying priority populations in orange. And then this is an example of what it looks like when we report out on progress toward targets. So what we're doing today will help us to get to a place where we can have these kinds of SMART objectives for community conditions so that we can be reporting out on an annual basis to see how we're doing. Looking at the components of a SMART objective, specific and measurable refers to the indicator and the data source. So that's the work that we've done, and just shared that list. Achievable and realistic refers to the target data value, and that's what we're going to be talking about today. Time-bound refers to specific years for the baseline and the target. We've set 2022 as the target year for all objectives in the SHIP, and the baselines will vary depending on our data source. It's worth spending a bit more time talking about these two words here, achievable and realistic. We think that it's also important to be aspirational, and there's a natural tension here between being achievable and realistic versus being aspirational. As we set targets, it could look like this, where we focus more on being aspirational, so we'd be really reaching for the stars, or we could be more realistic and take a more incremental approach when we're setting our targets. Or we could strike a balance between the two, where we would look at what seems achievable given current trends, but then reach a bit and push ourselves for a better outcome than we would see with the status quo. And now we would love to hear your voices. So we encourage you to raise your hand and unmute yourself, make sure that you have entered your audio pin, and let us know when setting SHIP targets, do you think the emphasis should be on achievable and realistic targets, aspirational targets, or a balance between the two, and why? The hand button should be in the top right corner of your screen. Alternatively, you can use the question box to type in, but we love to hear voices other than our own on the webinar, so we encourage you to raise your hand. So again, the question is, should we be achievable, realistic, aspirational, strike a balance? Okay, we've got a typed in comment here from Taylor, a balance between the two. Amy says achievable and realistic, given the short time frame until the next SHIP. Karina says achievable and realistic. And Amy, thanks for bringing up the time frame issue. So the SHIP is on a 3-year time cycle. In 2020, the state and local partners should all be synced up on the same 3-year cycle. We realize that 3 years is a really fast pace to think about some of these big picture outcomes. And so we have had some suggestions on other calls to think about also looking at some longer term time horizons as well. Okay, we have a hand raised from Cesare. Go for it, Cesare.
Hi there. I think that we should definitely have a balance between the two because community conditions or social determinants of health, it's different than the other work groups that we have and the subjects that we're covering. So we're going to definitely need to have an aspirational target that's going to have to be innovative and different to be able to address them.
Okay, thank you, Cesare. We've got some typed in comments here. Nicole says a balance between both. Not all outcomes viewed as achievable will be met, and we might get some aspirational outcomes that we didn't think we could meet. It doesn't hurt to have stretch goals if they are framed that way. Okay, so the importance of messaging with that. Mary Kay says a balance, if not somewhat aspirational, we risk the status quo. Too aspirational could result in frustration. Wallace says achievable and realistic. Amanda says a balance between the two. We should aspire to reach the best possible conditions for our populations, but not let them be so aspirational that they're not realistic. We should also focus on progress instead of just whether or not we reach the goal. And we have a hand raised from Shell. Go ahead, Shell.
Hi, I think that we should have a balance between the two, particularly when you think about sustainability, because even though our time frame is only 3 years, the work that we're doing, we should always consider sustainability whenever we start talking about targeting the outcomes.
All right, thank you. Okay, don't think we have any more hands raised. And looks like we had a few other comments typed in here. Jim says, I think a balance between the two. Andrew says, I'd support a balance, want some ability to get some early wins, but ensure that we are also striving to make meaningful difference. Okay. All right, I'm going to move us to our next discussion question. So we have 3 questions here, and you can respond to one of these questions or all 3. What experiences have you had with setting targets in your organization or community? Have you had any experiences with setting targets that were too ambitious or not ambitious enough? And what are the lessons learned to inform the SHIP? So I'm sure some of you have been involved in setting targets maybe for your own organization, or maybe as part of a community health improvement plan or an implementation strategy. So we'd love to hear, to learn from your experiences. Again, you can raise your hand, little hand icon in the top right corner, or you can use the question box. I know there must be people out there who've had experiences with this. So we'd love to hear both about experiences where something worked well or didn't work well. Okay. Oh, we have a hand raised from Cesare. Go ahead, Cesare.
Hi there. We've had experiences with setting goals that are not ambitious enough. And the outcome of that was we ended up, as stated before, just meeting status quo, or the outcomes just were lower than actually when we started. So it actually was a complete failure in that aspect. So you definitely want to make sure that our goals are ambitious enough to make a change and move that needle.
Okay, thank you. Okay. I don't think I see any new comments typed in. Amanda. All right. Amanda says, where possible, we try to align our targets with national targets like Healthy People 2020. Yeah, that's a great point. We're certainly going to be pulling the Healthy People 2020 targets. In some cases, the SHIP outcomes do have Healthy People 2020 targets. For the community conditions area, actually, there's not a ton that have Healthy People 2020 targets, but we'll be taking a look at that. It's a little awkward since 2030 targets are not out yet. But if anyone has any thoughts on that, if others feel that we should use Healthy People 2020 targets as targets for the SHIP for our 2022 targets, let us know. Okay, and we have Taylor has her hand raised. Go ahead, Taylor.
Hello, can you hear me?
I can. Go ahead.
Okay. So we worked, I want to say it was like 2 or 3 years ago, to set a new statewide coalition kind of work plan and some targets, and we got a bunch of different feedback from different stakeholders in the planning process. And then after we kind of finalized the plan, there wasn't that same ambition for reaching the targets. So we kind of had some difficulty when it came to like, okay, now we actually have to put in the work to get to these targets. So we had a lot of people voicing their opinions and saying this is an issue. We're passionate about solving this problem. And then we kind of, picked like 20 or so outcomes and narrowed it down to, okay, let's pick 2 and start working on those. And the 2 that we picked, there wasn't a whole lot of interest in them, and people weren't really kind of going outside their regular scope to help reach those targets. So I think we did an okay job in engaging the different stakeholders, but then it kind of came down to it, and no one was kind of there to help actually do the effort and do the work to reach the targets. So I don't know if that it's just kind of engaging more honestly with stakeholders and saying, we know that all these things are issues, but can we prioritize better, or what would you actually go and work on if you had to pick one of these things? And because I think maybe everyone's a little bit ambitious and just wants to tackle every problem all the time, and that's just unrealistic at times. So that was kind of our issue with having a lot of people saying that they're going to, all these things are issues, but then when things were finalized, not really moving on those things.
Yeah, so great reminder that our job is not done once we set the target. The real work happens after the targets are set. We have another hand raised from Shell. Go ahead, Shell.
Oh, actually, I had typed in a question. I was just going to say I was going to speak to, I think Taylor just finished talking, but pretty much we've experienced the same thing where, folks are very ambitious, you get stakeholder input, but then when it's time to do the work, I guess you can say the zest and zeal. I don't know where it goes, but it is the concern and issue. So,
okay, thank you. We have a few more comments typed in here. We have Wallace adding, I have been involved in the strategic planning process. Some of our targets have been too ambitious, but we planned for flexibility to adjust our goals. We learned to keep monitoring activities and making adjustments as needed. Okay. And then Mary Kay says, our most successful experiences have been when we seek input from relevant stakeholders to inform our targets. Great. And I'm going to move us along, but if you've typed in a comment that I have failed to read aloud, rest assured that we are able to download all of these comments and keep them as part of our notes from this work team call. So now we're going to look at priority populations. Move us along here. These are the groups of Ohioans who have worse health outcomes than the overall population. So that's what we mean by priority population. And these are some examples of priority populations that were included in the last SHIP. So we looked at race, ethnicity, age, gender, income, education, disability status, and geography. And what we were able to look at varied depending on the data source. So for some data sources, we can get quite a bit of disaggregated data, and then others are more limited. In a minute, Zach is going to talk about specifically which breakouts are available for the community conditions indicators. But first, I want to ask for your input on which approach we should be thinking about as we set targets for priority populations. There are a few different ways that we can think about setting targets for priority populations. And to illustrate two approaches, I'm going to use this apple tree metaphor that I'm sure many of you have seen before, or some similar graphics that look at the difference between equality and equity. In these pictures, the apple represents optimal health outcomes. The ground represents the social, economic, and physical environment, and the crates represent policies, programs, and other resources. In this first image, all three people have the same policies and programs, but two of them can't reach the optimal outcomes because of where they're starting from. In the second one, the apple crates are tailored and targeted so that everyone achieves the optimal outcomes. And this is what equity looks like. Now we're going to use this picture to talk about two ways to set targets for priority populations in the SHIP. In this first approach, which we call universal targets, we would set the same target for everyone. So the apple would be at the same level. So for example, the target for Black infant mortality rate would be the same as the overall Ohio infant mortality rate. This approach makes the case that we must eliminate disparities and inequities, and it's consistent with the goal of achieving equity. But of course, to be effective, it needs to drive targeted allocation of resources and funding and power. In other words, the targets are universal, but the strategies, those apple crates, need to be targeted and tailored with more resources directed toward the groups who have the furthest to go to reach the apple. So the important thing to note on here is that the apples are at the same level, but those crates are of different sizes, representing the targeted and tailored resources. The second approach would be to vary the targets for each population. So here the priority population targets would be set based on trends and baseline data and may therefore be different from the overall population targets. This approach is not consistent with the goal of achieving equity, but it is seen as being more realistic. So this really brings us back to that tension between being realistic and achievable versus being aspirational. Now we'd like to open it up to get your thoughts on which approach you think would be a better way to go for the SHIP. So again, we encourage you to raise your hand for this one, and we're asking if you would recommend that in setting targets for the SHIP, we use the universal target approach. So the targets would be the same for overall and for priority populations, but that would then, the size of those apple crates is different, representing a need to make sure that resources are more targeted and tailored to get to those ambitious goals. Or a population varied target approach where we would have different targets for priority populations depending on where those groups are at baseline. So I see we have, let's see. Barry says, universal target approach. Same targets, but provide more resources. Amanda says, for an equitable approach, I think we should go with universal targets. Okay. Again, we encourage you to raise your hand. Oh, Karina says, population varied because I think it will show us where the need is. Priyam says universal targets with increased resources to high-risk populations. Tara says universal targets that aim at equity. Okay. So it sounds like regardless of what approach we take on targets, hearing a lot of the importance of targeting and tailoring resources. Taylor says universal, but we have to avoid just trying to capture the low-hanging fruit and further increasing disparities. Cesare, universal targets because equity is important. James, universal targets, however, we are talking policy also when we talk about resources. Oh, question mark. Yes, when we look at strategies, we'll be looking at programs and services, but also looking at policy changes. Particularly important for community conditions, I think. Lisa says universal, but understand that different priority groups have different challenges to achieve the same goals. Okay, and again, we encourage you to raise your hands. We have Janelle says, if the goal is equity, then universal targets should be utilized, recognizing this may be aspirational. Okay, not seeing any hands raised, so I'm gonna move us along here just to see if you have any other suggestions for addressing equity in the target setting process or any other issues that we should consider. Again, we've elevated equity in the SHIP framework, and we really want to make sure that we have a strong approach to equity woven throughout the SHIP. Jenna says, would it be possible to set a population varied target that has the same percent change for each targeted group? So looking at kind of the rate of change or the percent change, making that the same for each group. Okay. Yeah, we could look at that. Okay. Now I'm going to turn it over to Zach, who is going to talk more specifically about community conditions indicators.
Thank you, Amy. So as both Amy and Erigina have told us, our objective today is to gather the guidance that we need to finalize targets, select priority populations, and then set targets for those priority populations for all of the community conditions indicators. We are not making any final decisions on this call today. We are going to be asking you to do some voting on some more poll questions, but again, this is all guidance for us to complete this work with the Ohio Department of Health. Just as a quick reminder, the desired outcomes that we selected on our last work team call were improve housing affordability and quality, reduce poverty, improve K-12 student success, and reduce reduce adverse childhood experiences. The format of our conversation is going to be to review the data related to all of the indicators that we selected for those outcomes, and then to ask you all a series of questions about each one of those indicators. The first outcome we'll look at is improve housing affordability and quality. So after consulting with some subject matter experts from the Ohio Housing Finance Agency, we settled on this indicator, the number of affordable and available units per 100 renters with income below 50% of the area median income. This metric captures affordability, and it is available at both the local and the state level. So this is an indicator that can be aligned at the local level. This indicator, however, is not conducive to selecting a priority population. So we just have one discussion question for you on this indicator, and that is, what factors do you think are important to consider when we set targets for this indicator? We'd like you to talk to us about measurement issues, federal, state, and local policy changes that might impact movement on this indicator, broader trends related to housing affordability, and then any other issues that you might come up with. Again, please raise your hand to make your voice heard, or type your question into the questions box. In the interest of time, we've got a lot of indicators to go through today. We may not be able to read all of the comments that come into us through the question box, but please be assured that we will be saving those comments and considering them as we do the remainder of our work. We have one question asking, this data is not available on the census tract level, and the data is available from the Ohio Housing Finance Agency's Housing Needs Assessment at the county level. I am not certain as to whether this indicator is available at the census tract level. We need to follow up on that. And here's the data just as a reminder. We have another question. What is considered affordable? And affordable housing is that a person is spending 30% or less of their income on housing costs, including rent and utilities. We have a comment here typed in that policies, including tax abatements for developers, are an important factor to consider for this indicator. Also, another indicator to consider may be the percentage of households spending more than 30% of their income on rent or mortgage. Thank you for that. Another question here, so there isn't an indicator getting at the quality of housing. Yeah, this is an issue that we've struggled with here. There are indicators that look at housing quality, but not that look at the housing quality issues directly associated with lead and asthma. That is available at the state and local level. So we've settled on this metric, recognizing it's not perfect. I don't think we've got any hands raised, and it doesn't look like we've got any other questions or comments coming into the box. So we'll go ahead and move along. Okay. The second outcome we'll look at is reduced poverty. For this outcome, there are two indicators, both child and adult poverty. These metrics are included in the online SHA, and we can see in the online SHA that child and adult poverty rates have both declined in Ohio, and that's been a trend since about 2014. Ohio's rate of adult and child poverty is similar to the US rate. So that's just some very basic information about adult and child poverty in Ohio. And we'd like to move on to our first discussion question, which is, what factors do you think are important to consider when setting targets for each of these indicators, both child and adult poverty? Again, please type in please go ahead and type in your comments to the questions box or raise your hand to be heard. Sorry, Taylor. We had a request to go back a slide here, and I'm just having trouble with my clicker. All right. All right, so we've got a comment in here. I think measurement issues are an important consideration. How can we get granular enough so as to effectively track differences over time in reliable ways? Dr. Beck, if you wouldn't mind elaborating on that a little bit, are you talking about the different measurements of poverty or getting to poverty information at the subgroup level? Okay. Uh, I have another comment here that policy changes are important in this area. All right. Well, not seeing any hands raised or any other comments coming into the questions box. I think we'll go ahead and move on to a conversation about priority populations for this target, for this indicator. So this slide shows all of the groups in Ohio that have an outcome that's at least 10% or more worse than the overall rate for the state of Ohio. Again, the assessment we did was 10%, not 10 percentage points. But in this case, all of the groups with worse outcomes are at least 10 percentage points higher than the overall rate. So both Black and Hispanic Ohioans, and then children living with a disability, are more likely to have a household income that's below the federal poverty level. Now we're looking at rates of adult poverty. Again, this is all the groups with an outcome that's at least 10% or more worse than the overall rate for Ohio. And here, Black and Hispanic adults, as well as adults with low educational attainment, are more likely to have household incomes below the federal poverty level. So now our discussion questions are, what factors do you think are important to consider in identifying priority populations for each indicator, and which priority population should be selected for each indicator? Okay. So we'll go ahead and take child poverty first. I'm just going to read some comments that have come into the question box. We have a comment here that I think place-based focus will be important. Another comment that we might want to consider another source as our source for child poverty may be more accurate. Okay. Dr. Beck provided some clarification that we need to make sure we're able to track over time. And that would be a consideration with using the ACS as a source. And we have David, your hand is raised, and you can go ahead and talk to us.
Thank you. I just wanted to point out that disability overlaps with both of these categories.
Thank you. All right. And now we'll look at adult poverty. David's comment there was related to both of the indicators, I think. But if anybody has any comments about adult poverty in particular. All right. Not seeing any other comments coming in or hands raised. We will go ahead and ask you a poll question. We're going to do several of these poll questions throughout this segment of the webinar. We are going to ask you to vote for one priority population, but please understand that that does not mean that there will only be one priority population for each indicator in the SHIP. So our first poll question is, what priority population should be selected for child poverty? I can't hear you. Okay. All right. I think we are about ready to go ahead and close the poll and show the results. So strong support for selecting Black and Hispanic or Latino for this priority population. Again, not making final decisions on this webinar, gathering guidance from the work team. Okay. Now we'll go ahead and move on to another poll question. And that is, what priority population should be selected for adult poverty? Our options here are Black and or Hispanic or Latino adults, and then adults with low educational attainment. All right, we'll go ahead and share those poll results. All right, so a more mixed feedback this time for both groups. Thank you very much. All right. So now we're going to ask you about setting targets for these priority populations. Are there any specific measurement issues, federal, state, or local policy changes, broader trends, or other issues that we ought to consider as we set targets for these priority populations for the poverty indicators? Taking, of course, the feedback that we heard during the earlier discussion about the importance of directing those resources and attention and power to those groups with the worst outcomes. Okay, so we have a comment here, and I'm going to ask Amanda if you're able to speak to us, if you'd be willing to elaborate a bit. The comment is that framing will be crucial so we don't perpetuate stereotypes about these priority groups. Is that framing of the target? Karina says that policy changes are important to consider. Amanda, if I'm not... Okay, it sounds like, Amanda, you're not signed in with a phone, so we won't be able to have you talk, but thank you very much for your comment. All right. Again, if you have comments you've not been able to share by raising your hand or typing them into the questions box, please do type them in or email them to us, and we'll make sure that they are considered as we do this work. So the next outcome we're looking at is improved K-12 student success. This outcome has two indicators, and we're first going to look at chronic absenteeism. During the 2015 to 2016 school year, 15.8% of students in Ohio were chronically absent, and this means that they missed 15 or more days of school, or about 10% of the school year. In Ohio's Every Student Succeeds Act plan, the state has identified targets and priority populations for this indicator. So to align with ODE's goals, our plan is to use their targets. So shown on this slide are all the groups that had an outcome 10% worse, 10% or more worse than the state's overall rate. So for this indicator, we'd just like to ask you these two questions. What factors do you think are important to consider in identifying the priority populations for this indicator? And then which priority population should be selected for this indicator? So I know we have some representatives from the Ohio Department of Education. If you're willing and able to give us your thoughts on this, we'd love to hear it. And then of course others are invited as well. Not seeing any hands or questions coming into the question box. Anna, we've got your hand up and you are able to speak.
Hey, this is Evan Dahl. I'm here with Anna and Shelby at ODE. We are thinking about the relative scales of the different subgroup populations as well. So for particular subgroups, you're talking about, many tens of thousands of students, and for others, you might be talking at relatively small numbers. So I guess it's a consideration across all kind of indicators, not just the education ones, but that's something on our mind at the moment.
Okay, thank you very much for sharing that. And we've heard feedback on other calls that we really need to be thinking about the number of individuals who would have to be impacted in order to reach a goal. And we'll certainly be taking that into consideration as we decide exactly how to come up with these targets. We have a comment here with a smiley face at the end. That's my laughter. That these factors, or excuse me, the factors that influence these different populations are so different. I would vote for all four. Certainly appreciate that feedback and understand where you're coming from. All right, so we are going to ask you to vote. No matter how painful that might be, we'll ask you to vote on the priority population to select for chronic absenteeism, African American and Hispanic or Latino students, students with a disability, or students who are economically disadvantaged. And you may notice that the terms that we've used to describe these subgroups are different for different indicators. Right now, we're using the language directly from the data source. And in the SHIP, we've not made a decision about exactly how those groups will be identified. All right, we'll go ahead and show these results. Strong preference for students who are economically disadvantaged for this indicator. Again, not making final decisions. There may be more than one priority population for some indicators, but we do appreciate your feedback. All right. The next indicator we'll look at is kindergarten readiness. In the 2017-2018 school year, 41.5% of children entering kindergarten were assessed as ready for reading instruction. This means that they are ready for the instruction that they will get in kindergarten. This number has been on the increase since the 2014-2015 school year. Unlike chronic absenteeism, the Ohio Department of Education does not currently have any targets set for this indicator that we're aware of. So we'll move through this series of discussion questions, which you're familiar with now. First, what factors do you think are important to consider when we set targets for this indicator? And Eben and Anna, we would certainly welcome your feedback again. Eben, you want to, or Anna? You are unmuted.
Great, we're back.
Great.
Yeah, probably over this 3-year horizon, there is a decent possibility that there will be adjustments to the KRA instrument, like a considerable shortening of the number of items. So I think just in terms of looking at this in a longitudinal way, we'll need to consider that. This year, there'll be several districts and community schools that are piloting a shorter version of an instrument this year, and then some decisions will be made with the community after that.
So a target that we set based on the instrument as it is today and the results we've seen today might not be reflected in future assessments.
Sure. And we'll probably be able to speak in more detail in that in the future as well, because we work with consultants that help us understand the comparability between our instruments over time too.
Okay. Evan, we're going to leave you unmuted because there's a question that came in here that you all might be able to answer over there. The question is there national data for this outcome, and how does Ohio compare to other states? I believe there is the national data. I'm just not familiar with whether or how Ohio compares to other states.
Yeah, I'm looking at my colleagues. I don't know that there is highly comparable data across the nation. I think different states approach kindergarten readiness assessment in different ways. To my knowledge, there's only a few that actually do like a universal administration. I think there's discretion in a lot of states at the school or district level as to whether they administer it.
Right. Okay. And my colleague in the room here just reminded me that this is actually an area that we're looking at for the maternal and child health grant, and there's they're not able to get that data at the national and state level. So thank you. All right. In the interest of time, I'm going to move us along here. Oops. Here we have data for the groups with an outcome that's at least 10% or more worse than the overall rate. It is just notable that these groups are the same groups that we saw experiencing the worst outcomes in the chronic absenteeism indicator as well. So I will flip back to the data, but now we'd like you to respond to these two discussion questions. What factors are important to consider as we identify the priority populations, and then which priority population should be selected for this indicator? So please go ahead and raise your hands, type into the questions box. I will just make a note that this metric looks at, this is a metric where a higher value is better. And that is different from the other community conditions indicators we've looked at. So in this case, students with a disability is the group with the worst outcome on this table. Not seeing any hands coming up, and coming to the end of our time together, I'm going to go ahead and just move us along to our poll question, which is what priority population should be selected for kindergarten readiness? Black, non-Hispanic, and Hispanic students, students with a disability, or students who are economically disadvantaged. So please go ahead and vote. All right, so we'll go ahead and close the poll. See, most of you have voted. Again, strong preference for focusing on students who are economically disadvantaged as a priority population. Thank you. All right, oops. Just want to real quickly ask you, are there any factors that you think are important to consider when setting targets for these priority populations regarding kindergarten readiness? Not seeing any comments there, we'll just go ahead and move us on. There was one comment that was typed in here that's there's a lot of overlap between Black, Hispanic, and economically disadvantaged. You could employ strategies to affect all three populations. So thank you for that perspective. All right, our final outcome for community conditions is reduce adverse childhood experiences. There's two indicators under this outcome as well. The first is the percent of children who have experienced 2 or more adverse childhood experiences from the National Survey of Children's Health. This metric's in the online SHA, and the prevalence of children with 2 or more ACEs is higher in Ohio than it is in the US, 25.1% in Ohio compared to 20.5% in the US. We do not have trend data for this metric due to limitations for the National Survey for Children's Health. And just as a quick reminder, these are the 9 ACE items that are surveyed for in the National Survey of Children's Health. So are there any factors we need to consider when we set targets for this indicator? Please feel free to raise your hand, type into the questions box. I'm sure some of you are drafting long, detail-filled emails to us as we speak, and you can send those to us after the webinar. All right, we'll go ahead and show you the priority population data. Unfortunately, some small sample sizes for the National Survey of Children's Health result in many suppressed and unstable estimates when we look at data for subgroups. Shown on this slide are all of the groups that had reliable estimates and an outcome that's at least 10% worse than the overall rate. So are there any factors that you think are important to consider when we identify the priority population for this indicator? And then which priority population do you think ought to be selected for this indicator? And again, here's a data. We've got a comment here. I'm trying to imagine what strategies could help reduce ACEs. And then the question, does the National Survey of Children's Health provide local data or only state level? NSCH data is available at the state level only. All right, Taylor, you have your hand raised and you can go ahead and talk to us. Taylor, we aren't able to hear you if you're talking to us.
Oh, hello.
Hello, we've got you now. Thank you.
Sorry, I muted my own phone just in case. There's a really good TED Talk out there from a woman from California. I don't remember her name off the top of my head, but she talks about all these different strategies that they employed out in California, specifically a very low-income neighborhood in the San Francisco area. And the first of that is proper screening techniques. So I don't know if I send it to one of you guys at HPIO, but I think ACEs are very, when you first start learning about them, they're very, very broad. But once you start looking at the specific strategies and the specific like screening tools, it becomes a very specific kind of targeted focus. So I use that TED Talk, like I showed it to everybody that I know pretty much. So I think that specific one does a good job of like putting action around a very non-actionable target,
Right.
if that makes any sense at all.
No, it does. It does. Thank you. Thank you very much. And yeah, was that Dr. Nadine Burke-Harris from California? She's done some really great work in this area. And we actually had the privilege of hearing her speak up in Cleveland several months ago. Right. And another comment here that this is another area where populations are going to overlap. So those low-income households and those households with children with special health care needs are very much overlapping. All right, so now we'll move on to our poll question. You won't be surprised by it. What priority population should be selected for the Adverse Childhood Experiences Indicator? Children with special health care needs, children who are low income, in this case, with income below 200% of the federal poverty level. So please go ahead and vote. You're all getting very quick at the voting. I appreciate this. All right, we will go ahead and show you these poll results. Seeing a theme emerge that there's interest in selecting low-income populations as a priority. So thank you. All right, and the very last, are there any factors that are important to consider when setting targets for these priority populations? I think we can apply a lot of the feedback we've gotten from you on other indicators to this indicator as well, but if you do have specific feedback, please type it into the questions box. The last indicator that we'll look at today is child abuse and neglect. The indicator selected for this metric in consultation with the Ohio Department of Job and Family Services and the Public Children's Services Association of Ohio is the rate of substantiated child abuse and neglect per 1,000 children in the population. This indicator is still under construction, and we hope to have data from the Ohio Department of Job and Family Services for this indicator in early August. In just the next couple of minutes, we'd like you to please share any considerations that you can think of for selecting the overall target, as well as any potential priority populations we might look at for this indicator. So you can go ahead and take those discussion questions in pair. Please type into the questions box, or if you'd like to say something to the group, go ahead and raise your hand. We're not seeing any hands, not seeing any comments. You all are wonderful for sticking with us through this webinar. We know we have asked you a lot of questions on a lot of indicators, but your feedback is valued. All right, well, not seeing any questions coming in or comments. Oh, we do have one comment that came in here. And that is that Black and brown children are often overrepresented in this system. I believe is the end of the comment. My computer is not allowing me to look at it all. Yes, Black and brown children are often overrepresented in this system, being the child welfare system. Thank you. And we've considered this. All right. Well, now I'm going to turn it over to my colleague, Erigina, who's going to wrap out the webinar for us.
Thank you, Zach. Moving ahead, HPIO will disseminate a link to the final SMART objectives list with targets by August. So keep an eye on your inbox for that information. The next strategy selection meeting is August 14th at HPIO. This is an in-person meeting, so your attendance is required as there won't be a call-in option. And meeting materials, including agenda, parking information, and directions to HPIO will be available on the Shawship webpage for that August 14th meeting. Lastly, as we conclude our work team meeting series, I would like to leave all of you guys with a quote from Andrew Carnegie, which really embodies the essence of our collective efforts to improve the overall health of our state. And it reads that teamwork is the ability to work together toward a common vision, the ability to direct individual accomplishments towards organizational objectives. It is the fuel that allows common people to attain uncommon results. Thank you for your time, commitment, and as Amy says, let's get Ohio in the green. You guys have a great afternoon.